Welcome back to the Healthcast. Today we have a special guest who's going to talk about the backbone of our life. Literally. Talking about spine problems today, in today's world where we all are going through cervical to lumbar back pain issues, we have our doctor, spine surgeon working for this industry for the last 20 years, an accomplished spine surgeon but who believes in holistic healthcare above putting you under the knife. Welcome to our show, Dr. Satyan Mehta, who has an extensive experience in modern and minimally invasive surgery techniques. Hello, sir.
Hi.
It's a pleasure to have you.
Thank you, Pooja. Thanks for the nice introduction.
Welcome. Yes, sir. So, how has been your journey for 20 years? Let's start there first. You've been working for the backbone, and we say there's a reason we call the spine the backbone.
Yeah.
So, sir, how was your experience treating the backbones of the people?
So, actually, it's been very fulfilling. In 20 years' time, I've seen a lot of changes in the type of patients that we get, the profile of the patients, their mentality of the patients, and the treatment that we have been giving them. So, I started in early 2000s, treatment of spine, where it was very, very basic. Even getting an MRI done was very difficult. After that, there was a phase where we were still understanding about what the importance of the MRI is, what the findings mean, and to the stage now where we have these facilities available at every nook and corner. Sometimes we send the patients to get an MRI done, they get it done in an hour and come back and show us the reports. So it's that quick. Compare this to something, say abroad, where they sometimes have to wait for months to get an
Absolutely.
MRI. So I think India has done well in this regard.
So taking a minute to just appreciate and let people know that how important it is and how blessed they are to get treatment in India. Because sir, I'd gone to the US last year and visited some places like this. So the patient was advised for MRI of the knee.
Right.
We were diagnosing it for lateral menisci kind of a injury. But the report till it came. First, this should be a thing, as you highlighted. The patient was treated. The rehab was done.
He's probably healed by that.
So, sir, thank you for the point where, because I think, don't you think it's little offbeat, but because I also keep treating patients of today's generation, don't you think the quality of patients also changed in the last 20 years?
Absolutely. So patients are much more aware now about various spine problems. Well, it's a double-edged sword. So thanks to Google and WhatsApp and your uncle sending you all types of messages.
Absolutely, sir.
That you may get some information, but there's a lot of false information out there as well.
So they should appreciate doctors like because you've seen 20 years, so things are different where they walk in with half Google knowledge and to treat them with patience. So some patients, how very important again, because when you talk about the spine, okay, it's one of the most Hindi mein nazuk, and we always say take care of your spine. We always say that.
It's not nazuk, but
it's the backbone.
Critical.
Critical. But nazuk means to be just fearful of having an injury where the spine is involved.
Absolutely.
I think it's the worst thing that can be done. In medical, we say that we can have any other injury, but not the spine. So, sir, how patience is important in this treatment of the spine? How do you deal with that where patients don't have patience?
So see, there is patience is required from the patients as well as from the doctor. Because we need to answer so many queries of theirs. People come with all sorts of questions. Of course, there are various types of patients. Since we are again going into that aspect, there are patients who just come and blindly follow you. So they have full trust in you. I love those patients. They're the best.
I love that.
And they do very well.
And they heal very well.
They heal very well because they have that faith. That whatever you do is good. And then there are patients who come in who just want immediate results. If this is not a Insta Swiggy thing where you're going to get a role immediately. So,
Okay, sir. So let's actually begin with the thing. So thank you, sir, for being so kind to be here. Sir, as we are living in today's age where everyone's sitting like a croissant, the spine has become the new croissant. And
it's the first time I've heard that one.
So we are with the laptop, mobile, we all are addicted. I don't know what is the thing. People are building money, of course, we all need it, but at the cost of the spine. So what is your idea of the new age people and even mid-age people to prevent getting under the knife for the spine, and
Yeah.
what can be done initially till they come up and you decide that, listen, we need to go for a surgery?
Yeah. So a very good question. Again, this is something that patients ask all the time. I'll divide it into a few things. Number one is for patients who are people who are have sedentary lifestyle. A lot of people come from IT sector as well. So they need to sit for long hours at their desk or their laptops, etc. For them, I give them a few pointers. Number one is that they need to get up every half an hour. So I give them, ideas like if you have a printer, keep it far away from you, so that whenever you need a printout, you need to get up from that. You can keep some alarms, etc. Say every 30 minutes, just get up even for a minute or two. You just walk up, go for a glass of water, or just go to the toilet and come, whatever. So you need to give yourself that break. Second thing is about the posture while they are sitting. So these they sit on those reclining chairs which go all the way back, and those are actually not very good for you.
Correct.
So you need to have a little fixed back type of a chair,
Yes.
and that helps a lot.
Yes.
Second thing is that their laptop or their computer screen is usually a little low,
The level.
and they end up crouching and to look at it. So you need to have that at a decent height, so that the height actually is supposed to be about 15 degrees. The center of the screen should be about 15 degrees below your eye level,
Okay.
or the top of the screen should be at your eye level, so that you are like comfortably looking a little down at it. And when their desk is a bit low, just it's a quick hack. Just put a book underneath it.
Yeah. So
Anyways,
just align it. Yeah.
People don't read at all anyway, so just use the book as a hack. Put the computer on that, a screen on that, and bobs around. So that helps a lot. Also, these chairs which have these wobbly type
Yeah,
of chairs,
yeah.
And they're no good. You need a good base so that
Yeah.
you don't end up straining your back too much. So these are the hacks which I tell them.
Okay.
Now, regarding more elderly patients and for patients, everyone in general, regular exercises is a must. You need to go for walks. You need to do resistance exercises, and you're the expert in that. You can explain,
Thank you,
guide
sir.
them about how to do them.
Yes, sir. So I was just coming to the eye level thing, sir. What
Yeah.
happens is, even if we know, like, let's take our example.
Hmm.
You have been into this,
Yeah.
and you have a wonderful posture.
Yeah.
Even after
Thank you.
these many years. No, I can say this because the first thing that a physio sees is a posture. It's a problem now, sorry. But I'm saying that despite, because I'm giving an example because even I am like, watching a video or I'm doing some editing. We are not going to be like this for all the time. That's
Yeah.
my question.
Yeah.
We all tend to have, because this is comfortable
Yep, absolutely.
rather than, so life, we like to be in comfort rather than.
Yeah.
So, sir, don't you think that having a spine rehab program, I mean to say specific muscle training, SMT,
Yes,
which
yes.
we talk about,
Yes.
which helps you to keep your, get back to your normal. As you talk about alarms, so which I usually put up as body alarms. Like your
Yeah.
body itself will tell you that,
Yeah.
So, sir, don't you think that strengthening program will
Strengthening
really
programs-
get you,
Yeah, strengthening programs are very, very essential,
Yes, sir.
and they don't just help to treat back pain, neck pain, but they help to prevent it.
Yeah.
You will be much more active. You'll be able to do more, activities without getting back and neck problems if you are doing strengthening programs regularly.
Absolutely.
So for younger people, I advise them to go to the gym under proper supervision, under training, under a good trainer. Do weight training. Even for elderly, we advise them to do some resistance exercises using therabands,
Absolutely.
using light weights, etc. Those things help a lot in getting their posture correct. And you need to visit the physiotherapist once in a while, even if you are okay. Because
for prevention. Thank you, sir. Oh, this sounds so well when a surgeon says, thank you, sir, thank you. I
Yeah,
think-
you scratch my back, I'll scratch it.
No, sir, but then
Yeah,
very,
yeah. On a serious
because
note, yeah.
in India, it's been, I'm still 9-year-old baby in this industry, but I've been struggling that where doctors don't give us that, that you can do it. So it takes a lot of, security when you say this. So only a secure doctor can support another person.
So I'll tell you, in my practice, the patients that we get, I almost 80 to 90% of patients are given only conservative management, basically medication, exercises, posture correction, etc., etc.
Absolutely.
And so many of these patients are sent to physiotherapists to start the training exercises. So we are not physiotherapists and spine surgeons are not antagonistic. They are complementary. We need to work together so that you give the best to the patients.
Thank you so much, sir, for making this. Coming to the point you just said about patients, we try to give conservative. What is the thin line when a patient comes in with an MRI report which shows disc bulge, the lumbar, cervical, and has symptoms, don't have symptoms. So let's talk about patients who walk in without symptoms and
or mild symptoms.
Yeah, but the MRI shows
Yeah.
massive changes. So how do you deal with these cases?
Yeah. See, it's a very common thing. Patients get scared that, oh my God, they've read the report. I've got this bulge, I've got this thing, I've got this thing, I've got this thing. I need to get so much of treatment, and what is going to happen to me? So, a lot of them just require reassurance. Most of these changes are normal changes. They are normal wear and tear changes. As one grows older, this wear and tear changes are common. I explain to patients normally that how, as you grow older, how your hair starts growing gray. As you can see, I've got a lot of gray as compared to her. So, this is all normal wear and tear which occurs. So, this wear and tear occurs in your joints as well.
Yeah.
So, you do see these changes in the facet joints, in the disc joints, and these disc bulges, etc., are normal according to the age. And if it is abnormal, then of course I'll be able to explain to them. And in general, if something is not causing symptoms, then it can be just kept an eye on, and we don't need to intervene.
So you don't have to really become
Worry about it.
And the one major reason is Google. Don't you think they have the report and they just see and they feel this is the end of the world?
Absolutely.
And sir, the way you said that it can be treated in movement is important. It's a major question for me.
Yep.
That where I hear spine surgeons, my patients coming to me after physio to pehle nahi aate wo. So they come after a month and they've been advised bed rest. So it's a major question from my end also.
Yeah.
That how important and when do you go for a bed rest over movement for something like this, like major spine changes?
Yeah, so bed rest, etc., was advised a lot right in the 90s and early 2000s. The concepts of treatment have changed dramatically since then. We have seen that giving too much of bed rest to people is counterproductive. It causes weakness of muscles. It causes respiratory decrease in their capacities. So bed rest is not advised at all. If it is advised, if it's a very initial, early inflammatory stage when the patient is in too much pain, that is the time when we give bed rest. Or if the person comes with elderly patients come with fractures in the spine.
Elderly, I think that's the word.
They come with fractures, so you give them bed rest, but it is with limited mobility. It does not mean that they don't get out of bed at all. So they are allowed to walk to the toilet. They are encouraged to get up and sit for their meals. Sit on your dining table and chair for your meals, and not to lie down and eat or drink anything. I'll just bring up this point because it's something which is a very serious issue which people may not realize. In elderly people, patients, even the family members, they say, "Nee, lie down and we'll feed you also on the bed."
Yeah.
And that is actually very, very dangerous.
Absolutely.
The chances of getting aspiration pneumonias, etc., are very high. And if something like that occurs in them, then it is disastrous because they straight away get into ICU and there's a very high chance of mortality in those people. So never ever eat or drink anything while on bed. You need to sit on your chair when you have your meals, even drinking water, everything has to be done.
So thank you, that was a reassurance because I myself, my whole motto is to move people but also answers a question about other doctors. I'm sorry, you may not take names here, but I have had young patients, आप तो जिनकी बात कर रहे हो geriatric patients, younger patients coming in telling my doctor has told me to stop traveling in 30s and 40s where travel is a part of their life because he has a spine problem. Speaks volumes the way you've told about someone who is lying on the bed. So sir, आप young patient को तो कभी नहीं बोलोगे. You will find ways that he should move. And you have brilliantly connected it to the respiratory, department because we see a lot of young patients when they are used to not move much. They've become, the body's also become rusted, how the iron does, So they are actually feeling like walking a half a kilometer, they feel, breathless.
Absolutely.
It's very normal. So, sir, you recommend that movement should be a part of your life?
Yes. So our goals of treatment is not just to take care of pain. Our goals of treatment is to bring them to normal function and normal life activities as far as possible.
Without surgery, initially.
Yes, absolutely.
So then what is a thin line again? Like just say that there's a patient walking in and then you're sure that this patient will go under the knife. Like just, if someone has to know?
So there are absolute indications of surgery, and there are something which are relative indications, or they are a little bit in the grayer area. The absolute indications are when there is a neurological deficit. So what happens is that we have from our spine, from the spinal cord in the neck, the back to the lower back, the nerves which go into the legs. If these nerves, the spinal cord, the nerves, they are responsible for strength in your hands and in your legs, for sensations,
Yeah.
for functions like bladder functions, even bowel functions.
Yeah.
If these functions are getting affected,
Yeah.
especially your bladder bowel functions
Yeah.
are getting affected, then it means that you need to intervene very quickly. Because if you don't, then this could become a permanent problem for them, and their quality of life reduces dramatically with that. So these are like sure shot indications that you need to intervene surgically. Then the next indication is that if it is a very unstable spine, like you get infections in the spine, you get fractures in the spine, you get these instabilities in the lumbar spine where it is causing nerve issues, and they are now going to go into, say, paralysis. So we need to intervene quickly and take care of it before it gets bad. So these are absolute indications. And then there are a lot of more relative indications. Like if a patient is not able to walk because of pain, and the patient has been trying with conservative treatment, with physio, with blocks, etc. And you cannot just keep the patient on bed, for more than a few weeks. You need to get them up and about. So if we can do an intervention and get them up and about, then it will improve their quality of life. Nowadays, these interventions are done minimally invasively.
Yeah.
So they are very quick in and out procedures. They take about an hour or so for the procedure.
Yeah.
And the patient also starts walking the same day. Right? And they are in the hospital maybe for 2 days, 3 days at the most. So the treatment has advanced so much in the last 20 years that we are able to offer these kind of procedures to patients, and their life improves dramatically. And and then they come back thanking us, and sometimes touching our feet because that it makes a real difference in their life.
Yes. So it's a very good point. So the fear in Indians of getting the surgery done, especially with the spine, as I said, they will go for a knee replacement where they don't need one also. Sorry. They may go for hip, but when it comes to the spine, the point that you just said, that they are okay lying down for months. Where a physio is coming and just, now that type of physio, so who are just doing pair upar niche and not being very safe zone, that it's okay as long as the pain. In fact, I think pain is a very good indication for your body to tell you that there's a problem there. So work on that area. So sir, isn't it like for a family, because as you said, the family becomes a prime motto there, who keeps giving the khana on the bed or who are very conservative. So to them, how do you explain, as you're an expert in invasive modern surgeries, that how quick and the rehab will be and the patient will be mobile, like, so can you just put some light on that it's not to worry about it and go and get the surgery done rather than lying on the bed?
I'll break your question to two parts.
Sure.
So the first part was about the patient mentality. Again, in the early 90s and early 2000s, the patients were very afraid of surgery, and rightly so, because it was in the initial phases, and we were also understanding how it is to be done. And thanks to my teachers who have gone through this, and thanks to all the literature and all in the world, that we have understood it so much better now. We know which patients will do well, which problems to be treated in what way. So now the mentality of these patients has changed a lot. Most people, when they see, they come to me directly saying, you have operated on my relative or my neighbor or my friend, and they have done very well. So I saw, we used to get worried, but I see them walking, and it's just been 2-3 days since surgery, and they're walking in the building compound. So we have also come for getting our treatment done for the same. So that mentality is changing thanks to the thousands and thousands of surgeries that we have performed as a spine community as a whole. I myself have performed close to 7,000-8,000 spine surgeries in my practice. So all this is goodwill which is helping to educate the patient. Because if we are Indians, we don't just believe on what the hearsay or what is written or what you and I say. They'll see, you saw that, and I saw that. I've got real proof in that.
I think word of mouth,
So that is the first part of it.
Absolutely. So then the second part?
The second
I think
part was,
like the one was fear, like,
Yeah,
and the
yeah.
second was like lying down,
Yeah.
like that kind.
So now this is about the technology part.
Yeah.
Nowadays, we are able to treat a lot of patients very safely because of a few things. Number one is anesthesia.
Okay.
Right, our anesthesia techniques and the anesthetist training has improved so well, so significantly, that we are able to treat patients with multiple comorbidities very safely. So we can operate on them very safely and get them do whatever we need to do and get the best results.
Yes.
Second thing is that the techniques have become more and more minimally invasive. So most of these procedures that we are doing have hardly any blood loss. We don't need to give blood. They are with small cuts, small openings. Uh, the time taken is very quick. So it is about 1 hour, 1.5 hour jobs.
Yeah.
So the patients are up and about much faster. And so the result obviously improves. You don't need to keep them on bed. They walk the same day after surgery and they are out in 2 or 3 days.
Yeah. Yes, sir. Okay, sir. Speaking about that, it's very common in India to stay with pain, right? They have this mentality, the pain has come, let's go with it. They go to a GP and take we know what they do. But sometimes the pain is deep rooted. It's not just a muscle pain. So how do a normal person, because so that there's more awareness that listen, go and see a spine specialist. Don't just go on your own medications or muscle relaxant. How do you distinguish between the just muscle pain and this deep rooted pain?
So what you've asked me is like a proper book on it, so you want me to give that in 2 lines, but yeah, so there are a lot of signs which we see. We have to, when we examine the patients, we see whether there is any radiculopathy, which means the pain shooting down the legs or into the hands. We examine them, look for deficits, which mean weakness in the hands or in the legs, look for sensory issues, etc. And there are special tests which we can perform to actually check whether there is a problem and how bad the problem is. And then, a lot of this depends on history. And we have very good investigations which are available. MRI has been a very big boon. And we are able to differentiate between patients which the pain which is like normal wear and tear pain, or there is something serious going on there which needs an intervention.
So coming to MRI again, so how it's a very personal question also, because I keep dealing with patients who are too much into MRI. We know that because as doctors we know, but as a patient, if we see something, we feel worried about it. So, but how important it is that the patient also depends on himself and the doctor over an MRI report. The MRI may be showing, as we had a word on this. So, do you think as a spine surgeon you immediately go for an MRI, or you can deal with it even without it?
So see, again, it all depends on my experience when seeing the patient. So if 99% of times when we see the patient, we are able to say what the diagnosis is. Okay,
without an MRI.
Without even an MRI.
So,
and we need the MRI to just confirm what is going on.
So why then people are going for MRI? Like if you are of that, because I completely agree with this, that coming with a...
So there are a few, your question is very loaded. There are a lot of aspects to it. Number one is, there are a lot of patients who come with functional issues, psychological problems, patients who are on hypothyroidism, diabetics, getting hormonal issues, perimenopausal women. So all these kind of problems can cause a lot of pains. But I cannot just tell them, no, nothing is wrong with you and just go. We have to get an MRI done to make sure that there is nothing going on. 99% of the time there will be nothing. But that 1% cannot be missed. We have seen patients coming with, say, cysticercosis. Have you seen a patient with cysticercosis? It's very, very rare. And we caught that because we got an MRI. I thought there is nothing because it just was, like in a 45-year-old perimenopausal lady. But we found cysticercosis on the MRI. So we have to get it done so that we are 100% sure. Today's day and age, we cannot be 99% sure. To be 100%.
So for that you think MRI it's...
And this next thing is that if the pain is getting worse, not getting better, and if we are contemplating something more, maybe surgery, or maybe pain management injection, or more extensive physiotherapy as well.
Yeah, you
So
need
in those
it.
cases, I need
Absolutely.
an MRI done so that we know what kind of treatment it requires and what level of instability or stability the spine has.
Okay. Okay, sir. Focusing on lumbar canal stenosis, as
Yeah.
the patient has everything's going well when he's sleeping, sitting, lying down. The moment he start walking or moving, the symptoms start aggravating. So, what is this looking like?
So this is a very common problem which occurs in the elderly. So as one grows older, because of wear and tear changes, the space for the nerves in the back gets reduced. It gets more and more compressed. This is called lumbar canal stenosis.
Yeah.
So when these nerves get compressed, while these patients are sitting or lying down, they are okay. But as soon as they stand up and start walking, because of that compression, the pain starts radiating from the back down to the legs. This typically occurs in the initial phases, after they walk for maybe 500 meters or a kilometer, and then they start getting numbness or pain in the legs, and then they have to stop. Gradually, as the symptoms get worse and worse, the walking distance goes on reducing. So after a while, they are not able to walk even up for 100 meters or so. As I said, this is very, very common with age, and typically this requires surgical intervention. Initial stages, we can do medication, physiotherapy, even give blocks, but usually if it goes on progressing, because you're going to grow older, the variant is going to increase, then they eventually need a surgery. These surgeries, as I said, are decompression surgeries, are very done minimally invasively nowadays. Through small openings, we just go in and decompress the nerves and come out. Typically takes an hour or so, and then they are able to start standing and walking the same day itself.
Okay.
So very common problems and very easy solutions for these.
Okay. But sir, I just wanted to put some light. For example, a patient starts with these symptoms. But is it sudden, or there are, I believe a body gives, I usually say this, your body whispers before it shouts.
Yeah.
So does it happen in this case?
Yes, absolutely. So these symptoms don't just come overnight.
Yeah.
It's been happening slowly. People tend to ignore them. What happens is that they say I used to be able to walk 5 rounds off the ground. Now I can walk 4, and then I can walk 3. So they just attribute it to age.
Yeah. So but initially, जब पता चले, so what they should do? They should
consult a spine surgeon or spine specialist, and then so that we can start the medication, start exercises. Also, their speed gets getting slower and slower. So they are not able to walk at the same pace.
Yes. So psychologically also, because we've seen patients go through so much, वो जो एक fear they come with when they come to us also, you must be saying that they feel they've lost it because they're not able to do the basic movement. So sir, my whole highlight to put it is we can deal with it at an earlier stage, not to ignore, because Indians generally have this thing कि चलेगा, अब तो ठीक हो जाएगा, मैं चलूंगा तो ठीक हो जाऊंगा. So I think because there has to be a scope, because they don't, even there is a part of their brain which is delusional, you know what I mean?
Yes.
They feel that no, ये अभी आया, ये 10 दिन पहले ही आया. So to convince them कि 10 दिन में नहीं हो सकता is my whole point, where you can put some light that.
As I said, typically they try to ignore their symptoms.
Yes.
However, it can sometimes get aggravated very suddenly as well. So if there with some small injury, a tear in the disc, it can then aggravate the entire problem, which has been going on since long, and then bring them to really bad state within days as well.
Okay, sir. So you spoke about decompression, you just doing these modern surgeries.
Right.
So how does that alone helps the deficiency or the problem?
So basically, the nerves which are getting compressed, we free these nerves by removing the excessive bone and excessive ligament which is causing pressure on them. Once that is done, then the nerves get space to breathe, the blood supply to the nerves improves, and then the symptoms come down. So then they are able to get up and walk, and perform their routine activities. I tell you, this is a big boon for patients, because if they don't get this done, their daily activities are affected a lot, and they are not able to go out and walk, they are not able to do their routine work. Once this is done, then they are able to lead a normal life. They don't need to be dependent on anybody for their routine activities. The quality of life improves so much.
Absolutely.
And we are social beings. The people in the older age, they need to go out and meet people, go to the temple, meet people, whatever. That is very important for their physical as well as mental health.
So I really like how you are focusing and even talking about factors like age here. So, but then I don't think so that you are not aware that all these are happening also in younger people these days. We are seeing radiculopathy,
Yes.
neurological issues.
Yes.
Sir, again a question from a physiotherapist point of view that how important is before getting into this, how important is to work on your paraspinal muscles, your ligamentum flavum,
Yeah.
by
Yeah.
releasing those muscles, which your physio does, and also strengthening the muscles or stretching the group of muscles, like depending what is weak and what is tight.
Correct.
And post surgery, as you just mentioned about geriatric patients or whoever you treat, the muscles are the same, sir, right?
Yeah.
Like it's just a basic question which would come that we are just helping with decompression and fusion. But what about the muscles?
muscle
They
rehab.
remain the same.
Yeah.
The grade, for example, when you call the patient or you put him for surgery, the strength was grade 3. It's not going to get better, it's going to get lesser, sir. So what about the post rehab? Because I see a lot of failure there, where a lot of spine surgeons, sir, it's a very personal question again, that they just say now you can walk. So how important is you can walk but not the health of the muscles supporting the spine?
Right. So, as you rightly said, rehab is a very important part of this. When you're talking about younger people, the more they do their muscle training exercises, the better their quality of life will be in the later stages. Okay. Of course, they will be more active and be able to do more sports, etc. when they're in that age. But even at the later stage, chances of getting problems become much lesser. And even if they do get injuries, they will bounce back much quicker if they have been doing their muscle training rehabs properly.
Yeah.
In the older people, people who have been little bit less mobile or on bed, it becomes even more important for them to do these exercises.
Yeah.
So this is surgery is not just the end all. As we said, we need to work together, and physio part is very, very important. Plug into your channel as well here that you need to do muscle rehab from a good physio.
Yes, so not just about me. I'm just generally saying that people have this lot of spine surgeons, and even I'm talking about knee replacement also. You must have seen it's become like a bread butter these days. Like how CABG was one big thing at a time. Now it's not.
Knee replacement is very, very common.
It's become like you enter a clinic and the orthopedic is so. But I've seen them saying that aap chalo theek ho jayega. So this whole concept of not building the muscles, and when I talk about knee or spine, I'm talking about all the muscles, sir.
Right.
I'm talking about the core, I'm talking about the pelvic floor muscles, I'm talking about the hands.
Yeah, all the accessory muscles
yes,
as well.
It's not just the primary muscles of the back, but when we talk about cervical, you know that it's related to lumbar or vice versa.
Yeah.
So, the whole thing of this. So, getting into your expertise, how pedicle screws and interbody cages, like how are they important in?
Yeah, so see, we have seen that with degeneration, a lot of times the segments become unstable. What that means is that the bone slips forward and so the nerves get compressed even more. These times we need to put in screws and even an interbody cage, replace the disc with an interbody cage to stabilize that area. And this is very important to do these procedures in select group of patients so that that unstable segment becomes stable again and their symptoms are resolved. So, as I said, this is very, very common now. People are growing older.
Getting into it,
Our population is actually becoming older. Say about 20 years ago, going into the 70s, 80s was more difficult and they used to have more health problems. Now, with improved medical technology and access to good health care, people are living into their 80s and even 90s very easily, and they are quite active and quite healthy during that time. So these kind of procedures are required more and more in these people so that they can lead a normal life.
Absolutely. So,
do you want me to show you the model?
Yeah, so please, can you?
Yeah.
I was going to tell you.
So basically, as I was showing about the instability, if you see, this is like a side view of the spine. All these are bones. In between you have discs, and behind this is a space for nerves. So if you see this bone over this bone has slipped forward.
Yeah.
And so this is causing more compression of the nerve at the back. And this is the segment which is now unstable. So what we need to do in these is to put in screws and put in a spacer. So this is like a model just to give you an idea. Okay, these are the screws that we put in. And if you see, this is the spacer which has been put in. You see this disc is intact, is completely normal. Over here there is a spacer or a cage which has been put in. This is just to give you an idea about how this procedure is done. So once this is done, then it becomes nice and stable.
So there's a quick question, just because I am a little inquisitive about the disc. So disc plays a major role in giving nutrition. So we all know that, right? To the area, and also it helps us for any kind of like all these, what do you say, stability, and helps in movement, and also I think it is like a shock absorber.
Correct.
Use that word.
Correct.
So then, how does this cage? If you're putting a cage,
So once this stabilization has been done, it's not going to have a normal. It's not going to be shock absorber, nothing. But we are only doing these in people whose discs are already gone.
You have no other option.
It's not working.
So, as we're talking about invasive surgeries, modern surgeries, how AI is playing a role in this now, as it is all over the place. How is it going to change?
So in spine right now, AI has not really had too much of an impact. I think it will be quite a while before it can actually make some impact here. It's not as straightforward and easy as say in other fields in radiology, etc. It is. One thing is that robotics has come into spine also a little bit. It's more in the other fields, laparoscopy and in knee replacements, etc. In spine, we do have robots which help in giving direction of the screws, etc. But they are at a very early stage. They are not that helpful. They add to the cost a lot and for no benefit. In fact, the robot sitting in front of you will give you a more accurate screw placement as compared to the machine.
So like for a layman, like, because when you go for surgeries, how these big hospitals have this entire bill showing you that you go for a surgery and they have options. They put you in front. Implant from Germany, implant from this. I'm just saying very normally. Switzerland, implant from India, and then you don't go for India for whatever reason. So can you put some light on implants internationally, implant from India? Also, how? Sir, हाँ इससे पहले बोलो फिर मैं
So good question. Again, you're making me feel very old. 20 years ago, the Indian implants were not as good, and we used to depend a lot on foreign imported implants. But now, since the last 10 years or so, the Indian implants have really improved. In fact, the Indian implants being manufactured here are getting exported to US and Europe, etc.
Yes, sir.
So, I tell my patients, why don't we should use these implants, which is almost 1/3 the cost of an imported implant, and will give you the same result. So, and Indians are price sensitive as well. And they want quality at the right price. So, what we are seeing is that now 95% of the work is done through Indian implants only.
Oh wow! So people are getting convinced. Sir, also robotic. You just spoke about the costing. Like it is not as efficient as a doctor standing there and doing it in spine right now. But then, sir, even if you talk about knee, like I'm just putting another point because you are also part of it. Because I keep seeing a lot of knee rehab cases, and where the patient has been, or the Indian culture of going to a private sector hospital, and they convince that going for robotic, when they come to me also, doctor, robotic surgery kiya, so you know that, right? So sir, what is this thing? How different will it be to go for a robotic, which is cost wise more than a doctor doing it? But how? Because I'll be very honest, I've done a post rehab of a robotic, which was not as good as a human. I'm being very honest. So, but the pricing is more. So, what is your idea on this with spine related? Like, if it's initial.
I'll talk about the knee from what I know. It's not my field,
but still,
of course we see our knee colleagues do this all the time.
Yes,
so a good knee surgeon is going to give you the same result as if you're with what you get with a robot. So if you want to do it, you can go for it. But if you're going for a good surgeon, it doesn't make much difference. But however, psychologically, if you feel no, I want it, it's fine. It's your choice. Now regarding the spine, only in certain cases which are very bad deformities and they're very difficult to get your good access of get a proper placement of implant. Those are the cases where robot may be useful. Those are very rare cases, and which we see like once in years. Those type of cases.
Okay, sir. So moving on to something which is very much out there, osteoporosis. And when I say
Mm.
that, I am not talking about geriatric patients only. Of course, when we say osteoporosis, it's something where your bones have become weak in very simple language for people to understand, but seen later life. But
Yeah.
what about rising case of osteoporosis even in perimenopause, especially
Yeah.
women?
Yeah.
It's become a like you
Yeah.
know
Yeah.
a thing right now that
Yeah.
you have
Yeah.
women in their early
Yeah.
40s having osteoporosis and being very fragile or very easy for fractures, or they
Yeah.
are bound to all these things.
Yeah.
So can you put some light on osteoporosis spine?
So again, it's a big question. What you've asked me. So osteoporosis is something which is it's like an epidemic.
Correct.
Because we are
Yeah.
seeing more and more of these cases.
Yeah.
There are a few reasons. Number one is that people are living longer.
Yeah.
And because people are living longer, the chances of getting osteoporosis in the elderly and is much more. Uh, in about 10-20 years ago, treating these patients was very, very difficult. We did not have the medication to build up the bones
Correct.
well. Nowadays, we have a lot of good medication which we can give, which are oral tablets, injectable, etc., which can help to gradually build it up. But compliance has been an issue, which means that patients, they don't take it. They want a magic
Right.
pill.
Achha.
So they just want one tablet or
Yeah.
one injection and it's done. So it doesn't work like that. You need to take it properly. But if you follow this treatment well, the chances of your getting fractures in the future are much lesser.
Yeah.
And you'll be more painless and you'll be able to function better. Osteoporosis is also because of other reasons.
Yeah.
The elderly thing is, and postmenopausal thing is one
Menopause.
thing.
Correct.
There are other reasons as well. People who are on steroids for
Yeah.
long periods, people who are asthmatics and take these steroid inhalers, people who have got rheumatoid arthritis and different types of arthritis who need to take steroids for their treatment. In those patients also, osteoporosis becomes a real problem, and it's much more than another individual who's not taking any of those medications. So, as I said, you need to consult your spine specialist and get the treatment done. Either a spine specialist or an endocrinologist or a rheumatologist, they'll be able to guide you with the treatment.
So that last line makes me ask you a question again.
Yeah.
Considering we are into this Insta world and social media, where
Yeah.
everyone's coming and talking about everything, in that nutritionists these days,
Yeah.
you know this, I think. I don't know whether you know it, but I would like to put up because I've seen it. They're out there to treat osteoporosis. So
Yeah.
first, I want to know that how important nutrition is in osteoporosis. Number two, you just said that there's a medication that you give the patient in the previous half. So,
Yeah.
so what is your treatment? Like, I want to know the medications, vitamins, as per Dr. Satyan Mehta for osteoporosis.
Yeah. Yeah.
And how well are nutritionists equipped to treat it
Yeah.
without doctors?
So, I'll tell you that nutrition is important, but it is more for preventing osteoporosis.
Not for treating.
It is not for treating it.
Yeah.
Once
Absolutely.
you've developed it, then you really need to get on the proper meds,
Yes,
which
sir.
only a doctor
Yes, sir.
is going to be able to
Absolutely.
do. And doctor, I mean, either your spine specialist or you're talking about an endocrinologist
Endocrinologist,
or
who
a
helps you with
rheumatologist.
yours.
These are the ones who will be
Correct.
able to guide you with that. A lot of patients come to me saying, "Okay, I've been taking calcium tablet, and why I still have osteoporosis."
Yes, sir.
So, just taking calcium or vitamin D is not enough.
Absolutely.
Bone has got two aspects to it. One is the mineral aspect, which is your calcium and
Yes.
whatever vitamin D you take to help the
Yes.
calcium get into the bones. The other is your protein aspect, your building blocks of your bone. And for that, nutrition is important because you need to have adequate proteins in your diet.
Yeah.
Our Indian diets usually are deficient in
Of protein,
proteins.
yes.
And so, if they have some kind of supplementation, or if they eat it properly,
Yeah.
get
Real
a
food.
nutritionist to help you out with that, that's a good thing.
Yeah.
Okay. The second thing is that just eating enough proteins is not going to magically go into your bones and help it. It needs to be loaded. So the bone muscles have to be loaded, and how you do that is with exercises.
Yes.
Which is not just walking. You need to do
Thank
either
you, sir,
some
sir.
weight training.
So repeat that line, sir. Walking is not enough. Patients walk in and they tell me we keep walking.
Yeah.
We
yeah.
keep walking.
Yeah.
And
Many elderly in my family also, they said, Satyan, why are you telling others to do exercises? they will get injured.
Yeah.
I do walks and
Yeah.
I'm okay. I said,
Yeah.
yeah, it's fine, but walking is
Yeah.
not enough. You
Yeah.
need to do some resistance training
Yes,
to
sir.
build up your muscle.
Yes, sir. And also as a just because you were talking about exercises, I think people are not aware of simple and effective exercises.
Yeah.
Where I pitch in, because what I'm saying is I work with rehab patients. Like
Yeah.
I just put a little light on that, considering osteoporosis. So we know that I get patients who are really down on their bone density when they do their test. But I have to be careful that they don't have injury. So there are injury-free workouts. People have to know. So when you see workout in India, they feel they have to just go, get up with the dumbbells,
Yeah,
go to the
yeah,
gym. That's
yeah,
again a wrong
They
thing.
get so
They
many
either
injuries.
know walking or they either know gym.
Yeah.
They don't know anything in between.
Yeah.
And there is where we work.
Yeah.
So there's an osteoporotic patient, how to rightly give pressure over your bone marrow, over your bone, and give you that resistance for your muscle,
Right.
apart from protein. So, but then can I still continue and ask you the medication that is your thing apart from calcium? Because as you said, calcium and D3 अकेले काफी नहीं है.
Right.
So apart from cholecalciferol or calcium, what has to be your
So I mean, it's getting a bit technical here, but
Yeah,
I'll
but
give you a broad
Yeah,
idea.
yeah.
So there are three types of medications in broad categories which we give. One is bisphosphonates.
Okay.
These are osteoclast inhibitors, which means that they stop the bone getting resorbed, and so they gradually help to build up the bone. These are available in tablet forms, jelly forms, injectable forms also.
Okay.
The second type of one is which is osteoblast stimulator, which is a teriparatide injection, and
Correct.
this is something which is very, very useful.
Yes.
Of course, there are indications and contraindications
Of-
towards giving it.
yeah.
We need to check, do our checklist and make sure that the patient is suitable for it. They are given in injectable forms and they are very useful for building up the bone. Again, it has to be taken properly. You have to follow the doctor's advice. You know, people just take it for 3 months and then they stop it. It doesn't work that way.
Absolutely. Yeah.
It's actually ideally given for 18 to 24 months.
Yeah.
Then the third category is now denisomab, which we are giving, which are also injectables given once in 6 months. And they are also osteoclast inhibitors and they help
Osteoblast.
so they also help to build up
Build
the
up
bone.
the bone.
Not as well as the teriparatide, but still quite good and
Okay.
easy to take. So once in 6 months is much more patient friendly than taking it on a daily basis. So again, don't do any self-medication. Obviously, you need to consult a specialist and you need to check your profile and then give your medication accordingly.
Yeah. So why I'm asking is because it's easier for these. They don't want to see a doctor. It's psychological, I think. People become, I don't have a problem is what they want to hear.
Yeah.
But sometimes to know that you have a problem which can be solved.
Yeah.
That's why I went into little bit of technical. Otherwise, people are on protein, on vitamin D or calcium. So this talking about osteoblast, how important it is and how a doctor will help you with periodic as per what you need, monthly, 3 months, 6 months is all as per your profile and as per doctor's profile. Okay, sir. So anything on you want to put light on women's health here on how can they prevent especially once the estrogen progesterone is not really playing the game?
So after menopause, the bones are going to start getting weaker and weaker as age goes on, and so women are much more prone to getting osteoporosis and fractures as a result of that.
Yeah.
So they get fractures in the spine, hip, and on the wrist very commonly. Treating the wrist fractures is relatively easy. Getting a spine fracture depends on what how bad it is. I mean, if it's a minor one, you can still treat with medication and all. But if it becomes more severe, if it goes for non-union, they may need things which we do like vertebroplasty and kyphoplasty.
Okay.
This is basically a minimally invasive procedure in which we inject cement into that fractured bone which is gone for non-union.
Okay.
It helps to stabilize it and reduces their pain. Along with that, then of course surgical procedures are also performed, which is also done minimally invasively.
Okay.
So we don't even need to open the whole spine. We just make small stab incisions, put the screws in, and stabilize it along with your cement.
Yeah.
These are all things which can be required if they get these fractures. The next is hip fractures. I mean, hip fracture is a very serious issue, and 90%, 99% of the times this will need a proper big surgery.
Yeah.
So if they get it, either they need to put a nail or they need to get a hip replacement.
Yeah, completely.
So prevention is far better
Than
than
going it
curing.
forward.
Yeah. So if you take care of your bone health,
Yes.
the chances of you getting all these problems is much lesser.
Yeah.
So your quality of life gets better. So how do you prevent it? Okay, number one is nutrition,
Yeah.
as we discussed. Take it of calcium, proteins in your diet.
Yeah.
Number two is exercises.
Yes.
Be active, go for walks, do some resistance training, etc. And number three is visit your spine specialist or your rheumatologist, endocrinologist, etc. to start your medication. So they'll be, if you require it, they'll give you some of the medication to prevent these fractures rather than
Yeah.
going in when it's too late.
So, but in India, too late is what they come from.
Yeah.
Yeah. So, how do women, especially because we see the women of the house? I'm sorry, it may be a little this, but usually the women are the ones who are known to take pain. You know, who are used to not take the health as priority
Yeah.
as a man of the house. I don't know,
Yeah.
but this is generally what I've seen.
Yes.
So, sir, do they start this during perimenopause, like before hitting the menopause, so that it's actually prevention? As
Yes.
because you have given a wide, kind of a insight to us what happens once you are falling for fractures. But what about when is the right period to prevent in women and start doing these hormonal?
Women more than men, but yes, for everyone, you need to start early.
Yeah.
And early means in your teens.
Yeah. Oh wow.
Yeah, right from your teens. If the more you're active, the more you exercise, you build up good bone. Yeah.
Oh.
So your maximum bone mass is going to be in your early 20s.
20s, yes.
After that, it is all downhill.
Yeah.
So from now on, it's all downhill for me.
Yeah.
Okay. So if I to maintain it with doing regular exercises,
Yeah.
weight training, etc., is the way to prevent these problems.
Okay.
Medication will be required later, so they don't need it so early. Of course, there are cases where you need to give it in the 40s and 30s and 40s also.
Yeah.
But in general, it is needed later on, 60s, 70s, etc.
Okay. So you put a very good point of teens here. So I just go a little off topic and I tell you that what message you have for the teens and for the parents especially, that how important are your child's teens, 20s, early 30s to build up that storage for 50s, 60s, 70s, whatever, 80s.
So not just your bone health, your overall health, your cardiac health, everything is determined by how you were, it starts right from the teens time.
Yeah.
In the last century, where I am from, we did not have that knowledge, and so it was feeding your kid with chocolates, with fast food, etc. was supposed to be a sign of prosperity. And getting a tummy is a good thing, but the atherosclerosis in your vessels, your bone problems, etc. It starts right from then. If you are more active, leading a better lifestyle by having good diet, healthy diet, and being very active physically as well, it will help to prevent problems in the future.
Correct.
So this is where it starts.
So they have to be very active because they're on their mobiles. You hardly see kids like us playing out.
Yeah.
So it's very important from now to build that.
Yeah. So you need to put them into sports. You need to put them into different types of exercises. Allow them to go to the gym and get these activities. Getting into this is far better than them getting into mobile gaming.
Yeah, absolutely.
Or getting into vaping, etc.
Definitely. So, as you just spoke about sports, so what is the idea of spine as a spine surgeon? How do you see injuries in young athletes or players, and what are the healing phases? Like we are speaking only about patients. So if I just go a little athletic and sports medicine, because I do work with a lot of these guys. So what is your idea with spine injuries, rest, surgery, non-surgery? How do you see that?
Mostly athletes who get spine issues, most of them don't require surgical management. Very few do. We know a few cricketers and who have required spine surgery. Because they get sometimes pars defects.
So can we speak about pars defects?
So what happens is that people who are doing excessive exercises, lot of extension, fast bowlers who do that, people who are into athletics, gymnastics who do these exercises. So because of that abnormal loading on the spine, they get a break in the pars interarticularis. That is a part of the bone at the back.
So can
Which I
we
can show you. Yeah, I have that here.
So, sir, this also goes for people who do ego lifting and people who work out more than what their weight is.
It is
Yes,
definitely
so
a risk.
we treat that. So can you talk about
So see, if you see, this is the back of the spine, and if, this is the bone from the back which goes here into the front, the pedicle in the front. So if you see here, there is a break between these two parts.
Correct.
So this is the pars interarticularis which has broken, and once this occurs, then it becomes painful.
Yes.
And so many people who are not athletes don't require surgery or anything for this. Can be treated with medication, blocks, etc. But for athletes who have to continuously load that area, they get a lot of pain.
Yeah.
Or even people who are into sports or into gymming, etc. They get a lot of pain.
Oriented.
Sometimes the nerve gets compressed and then they start getting pain shooting down the legs. Which would even affect normal walking, etc. So,
that can also happen.
Yeah.
So, sir, the whole point here to highlight is with younger athletes and people into fitness is there has to be a slow burn.
Build up.
Correct. You don't have to just go hit the gym because these days this Insta and all your social media celebrities, especially because you watch them, you like them, you watch your favorite cricketer doing the workout because
from my point of view, there are two types of exercises. One is for the showy muscles.
Yeah.
Okay? And the second is the functional thing, which will actually help you in the action or the activity that you need to perform.
Functional workouts.
So I personally feel you need to do your functional workout much more than the other aspect. It has to be balanced. But the muscle building part is maybe 10 to 20%. The functional part is your major 80%.
Yeah. So this can be highlight for people who go into the gym where they've been pushed. You've heard this word, that my trainer pushed me. I hear this whenever I see injuries. So how important it is to listen to your body and just go slow, I think.
I'll tell you from my experience.
Yes,
nothing against the trainers, but...
Sir, please be against them. I am.
Yeah.
No, you have to be because I think, sir, firstly, they're not knowing the physiology of the body.
Yes. So the trainers, they see whatever they're doing, they don't have that much of knowledge as compared to somebody like what you would have.
Yes, sir.
So, I mean, you're a Pilates instructor. Is a good Pilates with a good instructor is very, very helpful.
Yes, sir.
And even doing weight training and all, you need to be very intelligent. If you get a good trainer who will guide you in the right way, getting that itself is a big challenge. So the trainers normally just push you to do more and more, but you have to be very strict. As you're saying, I'm being strict with the staff. That you know what is best. You know what is best. They don't know your body. You know your body.
Yes,
so you need to guide as to what has to be done. Let them tell you the form, etc.
Yes,
you build up very slowly. Take your time to build it up. This is not a 100-meter dash.
Absolutely.
You're talking about a marathon of your life, which you need to go slow and remain healthy. Getting an injury will put you back by 3 to 6 months. Sometimes you need to get operated for these injuries, which takes. Thanks to the trainers, I'm earning money because I need to operate on patients.
So that's why you're not against them, huh?
They are also.
But we
need to train them.
Yes,
in the right
sir.
way.
I completely believe we need to train them to train.
Yeah.
So coming to, as we're talking about all this, coming to cervical myelopathy. So can you put some light and...
Cervical myelopathy, yes, so again it occurs mostly in the elderly, but it can occur to anybody. In our neck, the spinal cord from the neck, it goes down. It is responsible for strength in the hands, in the legs, and sensations as well as your bladder and bowel, which means your urine control and your bowel functions. So if the spinal cord starts getting compressed or starts getting damaged over there, then you can gradually start getting these symptoms. Typically what people get now, they get instability. So when they start walking, they are not able to walk properly. The leg they want to go straight, but it may go here and there. So balance may be an issue. Walking on even surfaces is fine, but on our routine Mumbai roads, they may find difficulty in walking there. And then using the hands for fine functions, counting money, writing, using the fork, etc. may become more and more difficult.
Finer movements.
So that is how it starts. And if it goes on worsening, then their functions go on reducing. Then eventually they are not able to even hold things. They are not able to walk at all. And so this typically requires surgery,
Yeah.
where we need to do a decompression of the spinal cord,
Okay.
either from the front or from the back.
Okay.
Again, these are all routinely done by any good spine surgeon, like or experienced spine surgeon like me.
Yeah.
The importance here is that the earlier you do it, the better the results are. Because once the spinal cord is damaged, then you cannot reverse it.
Yeah.
So, if you treat it early, you can halt it there and the
Yeah.
patients have a better quality of life. But if you come too late,
Yeah.
then it's very limited amount of improvement that you can get with the surgery.
Sir, again, I have a question, which is, जैसे आप story, you're saying the storytelling is a part of my life, where they walk in.
And repairing the spine, you broke.
I broke it.
Yeah.
I was just trying to do what people do in the gym. So they do this, and then this happens.
Yeah.
So you can fix it. But they again try, the trainers try to fix the spine also. You know that?
Yeah.
So, sir, as you mentioned that when a patient walks in for cervical myelopathy, in most of the cases, surgery is the option. So what are the reasons you think there's a delay? There is, no lack of awareness, or they're trying other adjuvant therapies where they feel they don't have the acceptance that they have a problem.
Yeah. So cervical spine surgeries are slightly more complicated, and you need to go to a senior person, more experienced person for getting these done. There is a higher risk of getting complications in these. So people do get worried for this, and so they try out different things. When they often go to Ayurvedic treatments, go to homeopathic treatments, Unani treatments, etc. I don't mind them going for all of that, but really it's not going to work, and eventually this will need surgical management. The problem is that it causes delay.
Yeah.
And that delay is the thing which hits, and they get worse by the time they are back. Where we would have brought them to good near normal functionality, we will have to do with whatever the stage they come in.
Yeah.
They come very late, and they're not going to improve too much after the procedure.
So because the medications that you spoke of, or the adjuvant therapies that you just mentioned, they usually do this to just manage pain. So, sir, how important it is for even the Indian audience to understand that mobility is more important than just looking at pain, right? Like we just so much concentrate towards pain or the symptom. So I completely, as a physio, believe, which I think, sir, you may relate or agree with, is movement, pain with movement will still be better. Like, it will get better than having pain just at rest. You know what I mean?
Right.
So they are just concentrating on pain and symptom rather.
In fact, these patients who have got spinal cord issues, they normally don't get too much of pain. They have got problem in function.
Mobility, correct.
Walking, holding things, they're normal looking functions. They get numbness in their hands and legs. There's some, many times it is not caught as well, because going to your family physician, they're not equipped to get those diagnoses. So most of us specialists, we hold a lot of talks, we hold a lot of seminars with family physicians as well, so that they are also more aware of all these problems, and so that they can catch them and send the patients, refer them to the higher center before it is too late.
So that's the reason also, sir, maybe that they come so late to you all. Like, I'm being, a little from a patient point of view, like from a family who has a problem, coming to a surgeon and then saying that surgeon ne to surgery bola. So if they're coming at that point of time where the surgeon has no option but to put you under the knife, then it takes, because this is there in India, there is a lot of things that we don't go to the surgeon. See, this is the reason I didn't go. Patient will come and tell me because he said I need to go for surgery, but they don't realize that they've wasted all these years in
So the thing is that, as I told you, 90% of people who come into my office, they don't need surgical management, and it's not even advised, as we do the routine treatment. But this comes in that 10% category who need it. I mean, if I'm going to give the treatment which is required, which will help them, and rather than just what the patient wants.
Exactly, sir. So it's very important again to just come to the specialist at the right time, so that they are also, better, much better, and they don't have to go through that.
So this needs, these kind of patients, they need a lot of counseling. You need to do a lot of hand holding, and you have to work as a team. It's not just I am saying something and the patient has to. We need to talk about it, discuss how things are going to go further, what are the risks, what are the benefits of getting these done, so that the planning is proper, so they have a proper expectation of what is to be, what will go on with them and how the improvement will occur.
Okay. So now, as we're talking about improvement in rehab, I would like to put some light on mental health also,
Yeah,
because it is important when we
Yep.
speak about pain, and we all know that it's all in the mind. We always say this, and it is actually.
Yeah.
So, sir, we have central nervous system and we have the peripheral nervous system. So, you're the king of peripheral nervous system, means you're working on the PNS. So, how does mind, mental health, stress, today's every teen also has stress, builds up to these conditions, and what is your
mental health is very, very important. Okay, how well a patient does with treatment, it depends. 90% of it is their attitude. Okay, if they come in with a good attitude, if they are motivated to do well, they want to get back to normal, they will get back to normal. Okay, so they will be able to tolerate pain much better. They will be able to get into rehab, get into their exercise program, and get up and about much better than somebody who's less motivated. So we need to take care of that aspect. So that is why a patient A and a patient B, both of them having the same problem, will not do the same, because these are the other factors which do affect the way they do. And this is true not just in our treatment of their spine issues. It is in their entire life as well.
But then, sir, how pain, like back pain, we usually say that it is not just mechanical. It has to do with other psychological factors. So, is all the aches and pains, especially these young crowd are having, who are working day in and day out, but they are not healthy? When I say the spine is not healthy, so how important role stress is playing in there?
Yeah, it's very, very important. Mental stresses will just shoot up even if you have a little bit of pain, which is in your scale of about 3-4. If your mental stresses are high, it goes to 8 or 9. So one of the important work which I do is to weed out these patients. So when they come into the clinic, I need to know which patients have these issues. And very often we do treat them for those stress related issues also. It is part of the medication. Sometimes we need to refer them to psychologists as well. And most importantly, we need to reassure them that you'll be fine, and you don't need surgery, and just follow this.
So we'll go to cervical cord compression. So and
that was my
it's done.
So
you're going to speak about how these surgery cases recovery, as you just mentioned. So how is it? Is it faster?
It's not. It takes much more time.
Yeah.
So you can ask about difference between that and the lower back.
Okay. So what is the difference between the recovery time of a lower back surgery or a compression surgery and a cervical, and how different it is, and how careful a patient has to be during the symptom time also? Whether it is cervical or lumbar.
Again, completely different issues, apples and oranges. Lower back, lumbar spine surgeries, which we do commonly, are much quicker, more minimally invasive, and they can get up and about very, very quickly, even in elderly. Cervical spine surgeries, where the spinal cord is getting affected, where they have weakness in the hands and legs, it takes much more time. The rehabilitation is slower, it takes longer, a lot of work needs to be done on them, and they may never come back to full normal activity. So they do improve, but a little bit of residual weakness may remain in these patients, which is why it is very important for them to come early. And if we treat them earlier, their overall function result is far better than if they come too late when they are almost completely paralyzed.
So so the sensitivity towards the cervical spine is more, of course, than the
spinal cord.
The cord where it starts.
Then there is another aspect in the spinal, in the cervical spine, where the nerve is getting affected, not the spinal cord. The nerve, when it is getting affected, becomes the peripheral nervous system, and those patients recover much faster. They are like the lumbar spine surgeries, where it's quick in and out, and they are up and about quickly.
So as you just mentioned, there's some residual which is always there. So that how do a patient look over it psychologically? Like for example, you told cervical. So you may say that you may have little weakness in your leg or your hand, which will sustain. So how does that patient take it then? Can continuous rehab program and exercises and giving them that nerve program peripherally, can that change, or it will always be like that, or it depends?
Every patient is different. And depends on a lot of factors. Number one is the time when they come in. I keep stressing on that. If it is too late, the spinal cord has got very badly damaged, then they are not going to get fully better. The second thing is if they are very heavy patients, it takes more time and they may not get back as well. Diabetics will not do as well. So you need to have good control of that. Smokers, patients who are taking more alcohol, these kind of patients also will not do as well as patients who come in early or who are more motivated. Okay. Psychology is also a very important factor.
So just as you mentioned, so it gave me a question to ask you that today's world, three factors are what we are living in. So first I'll divide two and then I'll come to the third one. The first two is what you just mentioned. How is alcohol and smoking, nicotine, affecting spine health? Generally, we talk about spine because you're the specialist.
So, I mean, I'll tell you what studies say. So, taking mild to moderate amounts of alcohol occasionally, socially is not is okay. It's not going to cause too much of problems. But if you are an alcoholic, obviously it's going to cause problems, not just on the spine, it's just on the overall health of your body. दारू पीने से liver खराब हो जाता है. So this is about alcohol. Smoking is something which is next level. Nicotine and smoking in general causes affection of all organ systems in your body. Almost every organ in your body is affected by it. So, some kids come and saying, they're taking vaping because it's better than smoking. Really, it's not. I mean, the amount of nicotine that they get in from each puff is far more than what they get in through this. So, it's not good for you. It's going to only cause problems. It's going to reduce your lung capacity. It's going to reduce your effectiveness in exercises. It's going to cause kidney issues. It's going to cause nerve related issues and desensitize your nerves. So stay away from it as much as possible.
So to just again reconfirm and reassure, maybe I know somewhere what the answer is, but people these days, especially the influencers, are promoting alcohol and vaping normally and saying that they outdo it with exercises.
Yeah.
So does that happen?
Absolutely not. Absolutely not. The best thing is to stay away from it. And if you're doing your exercises and when you're smoking along with this, there is a higher chance of you getting a heart attack, for example.
A higher chance?
Yeah, a higher chance.
And alcohol also, of course, like you are.
I have never seen anybody who's consistently doing this and sustaining themselves. So eventually it is going to catch up.
Sir, I can't end the podcast without asking about beds, pillows and spine. So, your relationship, ready to sleep, yes sir, always. So, what do you think is the connection between spine, cervical, neck pain, back pain and the bed, the quality of bed and the pillows?
Yeah. So again, a very common question which people come with, what type of pillow should I use? Especially for the neck.
Yeah.
In general, I mean, people are different. Everybody's different. What works for you may not work for somebody else. But in general, I don't advise them to take those big fluffy pillows. Medium-sized and medium-hard pillows are better for them. But take whatever suits you, whatever you're used to getting. When you travel usually, and if you're in hotels and all, those pillows which are very soft, you're not used to them. A lot of people get up with neck pain. We had our cricketer who also got up with the neck pain recently, and he could not, perform in the test match, and we ended up losing that match as well, and was out for a month. So these kind of things can occur if you're not, if you don't what you're used to. And the bed also should be medium hard bed, not those soft ones where you completely sink in. And it needs to give you some counter resistance. So normally mattresses may, they have these orthopedic grade mattresses. Those are quite good. And the newer mattresses are very good, the ones which have got those shells with gels in it. So they're quite good. And they last for long and they don't sink in. So those are nice.
And sir, a question of no pillow or pillow?
Yeah, I mean, no, it doesn't make too much difference. Getting a pillow is good for you.
It's so no pillow is, I think, if we go in a little, correct, it's a myth. So having no pillow.
Having no pillow is not a good idea.
So patients walk in and they say that I have neck pain and I've removed the pillow.
Yeah, I don't usually advise.
Yeah, even I don't. Yeah. So that's completely cervical extent.
It's far better for those kind of patients to come to you and do the neck exercises and that rehab process rather than the pillow is not to be blamed.
Yeah, so this I want to know. So very good point you just said it, that the pillow cannot cause you the spasm.
Mm.
The beds, they can in the long run, but it all depends how you're taking care of your spine.
Yeah,
Correct?
that's
It
more
ends
important.
up that way. All right, sir. So we will go for rapid fire. I think these days it's very.
Do we have guns here?
No, sir, please. With Durandar online, we can't speak of all this. But we would like to just keep it very rapid and full of fire.
Okay.
Sir, I have my laptop for that.
Yeah.
Okay.
Does rapid fire mean I have few seconds to think?
No, sir, you can think, Aram say that's completely fine. But you can answer the ones you want to answer also. It's like you can just.
Okay. Let's see.
Yeah. So, one myth patients believe about spine surgery.
Well, it's changing, but initially they used to think a lot. Okay, they have to be completely on bed for weeks or months after that. But nowadays that myth has changed a lot.
Okay, sir. So the most fearful term on a report like MRI, which should not be feared about.
Yeah, disc bulge.
It's normal.
Yeah,
Let's
it's normal.
make it.
People get really worried. They come and say, "Yeah, I got so many bulges."
Yeah. So
it's all normal.
Yeah, it's normal. Yeah. Best daily activity for a long-term good spine health.
I would say weight training rather than just walks and all. Weight training is better.
Yes, sir. Yeah. Thank God you didn't say walking, sir. Okay, worst advice spine patient gets from the internet.
I think everything on the internet is
yes, sir.
is wrong.
I also believe so.
Yeah, you need to really consult a spine specialist.
Yes, sir.
Far better.
Also, one condition that is commonly over-treated. You think it's
over-treatment? I think people do over-treatment of vitamin D deficiency because they just go on popping it. Calcium, taking too much calcium tablets also is not a good idea. You need it. Some people do need supplementation, but overdoing it is quite common.
Okay.
And over-treating disc bulges again.
Okay. And so undertreated, one condition which is undertreated, you think it's not?
Yeah, as we discussed in our
podcast,
osteoporosis is quite undertreated. Yeah.
Okay. So one red flag that needs urgent spine evaluation. Red flag.
Anything which causes weakness in your hands or legs or difficulty in passing urine or stools, numbness in those areas. These are your big red flags.
So disc problem, age related or lifestyle?
Both, na?
So
both
it can happen.
Yeah.
Both. Okay, sir. So one thing patients always ask you before surgery.
When do I get back to work? I guess. Yeah.
Okay, sir. So most important factor for good surgical outcome.
Patient outlook. I think the patient mentality is very important. Yeah. Everything else I can take care of. The outlook of the patient is,
So walking or rest, I know your answer, but I'm asking you. Walking or rest better for spine patients?
Walking is better. Always.
Yeah. So do you believe that a good physio program will change your patient's post-rehab care? Absolutely.
Post-rehab, a good physio program can prevent them from needing a spine specialist.
Oh, wonderful, sir. Okay. So, do you believe that a good, like a surgery has been decided for a patient? Like, so a patient should go for a pre-rehab also?
Yeah, it does help. Yeah. But you need to, every patient is different, every problem is different. So, you need to speak to your spine specialist when you're doing this.
Okay, sir. All right, sir. So, if you had to give one spine health rule for everyone, a rule like if you, Dr. Satyan Mehta saying this for spine health, so what would be that rule?
I think regular exercises and good lifestyle.
Okay, sir. Okay, sir. So thank you so much. It was incredibly my pleasure to have you, and I've had out and out so much. I've known more about spine health and surgery, and also my outlook for surgeries and invasive, non-invasive surgeries have changed. Specifically this morning, meeting you and speaking to you, and the way you.
I hope it helps. Spread the word and giving more information to our public and population.
Yes, sir.
And in case they need some question, they have some question, they can always
Yeah, yeah.
put it up, and maybe we can answer
Yeah,
them
yeah, they can
later
put it
as
on the
well.
video, they can put and
Yeah,
we'll answer,
yeah,
the team
yeah,
can do it.
yeah.
So, yeah, thank you, sir. Thank you so
Thank you.
much.
Thank you.